thrilled to turn the stage over to Dr. Sarah Goulet, who is the Associate Dean of Admissions. I'm going to say here in Winnipeg at the University of Manitoba, but I'm in London, Ontario, so I'm in my in-person head at the moment. So Sarah, I will invite you to our virtual podium.
Hello and welcome again to the University of Manitoba. I too am actually not present at the university today. I am working up in Island Lake in Garden Hill, Manitoba. I'm a family doctor, and most of my practice has been for more than 10 years in rural, remote, isolated communities in northern Manitoba. I'm Métis. My traditional homeland territory is in Winnipeg, but I've had the gift to be able to travel to different parts of the province and serve patients there. So I encourage anyone, all of you, to help us to understand where you're from today. You know, it's a little bit unfamiliar for us not having you all in the same room and getting the chance to meet you and talk to you face to face. So I think it would help us to learn more about you and what your needs are if we had a better idea of where you're from. So please include that in the chat. I would also like to just acknowledge the University of Manitoba campuses are located on the original lands of the Anishinaabe, Cree, Oji Cree, Dakota, and Dene peoples, and of course, the homeland of the Métis Nation. So thank you. Thank you all for coming. We're so excited you're here.
Thank you, Dr. Goulet. And we're delighted to do this partnership with you again. And when I hear our 20th year, this is wonderful. So what is the Canadian Medical Hall of Fame? Like a sports Hall of Fame or a music Hall of Fame, we are an organization that recognizes great heroes in healthcare in Canada. And we're 26 years old now. And really, we were founded to provide role models for you. Role models for young people who are interested and passionate about science, so that you could learn about these wonderful stories of great Canadians who have really dedicated their lives to advancing healthcare. So we honor excellence, and we do that by honoring our heroes and annual induction ceremonies. We preserve the history of their incredible impact stories, and we inspire generations through those stories and also through our educational programs like Discovery Days. I encourage you to visit our booth, and there's also a video that I know was posted in the chat. We also have 137 laureates that we've honored to date, with 6 new ones every year. There are a number of people connected with the University of Manitoba, and there's a slide just from some of their portraits that are up at the medical school. The last couple of years, there's been a new recipient. So we quite a strong representation in our hall from the University of Manitoba. And one of those laureates who is here today with us, as I mentioned earlier, is Dr. Cheryl RockmanGreenberg. And she's a rare genetic disorders expert. She's a clinical scientist at the Children's Hospital Research Institute of Manitoba. And she's really, you know, like so many of our laureates, dedicated her career to advancing knowledge. And in her case, it's bringing advanced medical knowledge to the care of isolated and often vulnerable populations. She's a distinguished professor at the University of Manitoba. So we know she has a lot to say, and what I'm going to do is start with her next slide and just, you know, view this slide and absorb it in all its meaning as we hear from Dr. RockmanGreenberg.
Thank you very much, Heather, and welcome everybody. When Heather asked me to say a few words, message to my teenage self, it brings back incredible memories of the phone call I received several years ago to say that I have been inducted into the Canadian Medical Hall of Fame. At first, I didn't believe it. I said, I really like sports. I said, well, maybe they mean Sports Hall of Fame or something. But I was absolutely humbled, and it is an incredible organization, and I'm very grateful for having this opportunity to share a little bit about how I got there, and especially to talk about what it was like as a teenager. I would like to start first by saying that I recognize that the time that we're in now, the COVID-19 time, is a very difficult time for all of you and for me as we try to stay well, keep others well, and continue to navigate the road ahead to your futures. I appreciate that this is a very, very difficult time, and I totally admire the efforts that everybody has made to make things as normal as possible for you. But if you can seamlessly navigate Zoom and all other platforms seamlessly, as I know that you are doing, you've already demonstrated resiliency, steadfastness, and I know that you'll be able to meet the challenges ahead. This slide, it shows a picture that is attributed to Yogi Berra, who's a famous baseball player. And the quote that goes with this slide says, "When you get to that fork in your road, take it." Now, obviously, you don't know what to take. Do you take that road to your right, where you can see deep down, there's a clearness, there's sun at the end of the tunnel? Or do you take that road to the left that meanders and seems to have some obstacles, and you don't know where both roads are leading? But the bottom line is, both roads, no matter which road you take, will likely, with hard work and steadfastness and mentorship that you all will receive, will lead you to the desired end goal with respect to your careers. When I was a teenager, I faced many challenges, and I finished high school in 1967 in Montreal, where I grew up, and I was 16 years old. And I always liked science, but I had no idea what to do. I was a second-generation Canadian of hardworking parents, but no one had gone to university. But I knew I liked science, and I registered at McGill. And I registered in physiotherapy, which was a wonderful field, but in 1967, it really wasn't the dynamic med rehab field that it is today. And it just didn't satisfy my need. So I went back into science, having reached this fork in my road and didn't know what road to take next. And I entered just a Bachelor of Science undergraduate program. And at my very first lecture that I took in the course on Introduction to Human Genetics, I was hooked, because of the two professors who shared their vision about what it was like to be a geneticist and what they brought to healthcare. And they were my mentors, and they continue to be my mentors throughout my training. And I moved to Manitoba in 1978, and I've been here ever since. And any success that I've had in my career, it's really because of the mentorship and support that I've received from my colleagues at the university as a whole, to whom I tremendously looked up to, and the vision that people felt that I had the ability to do things, and I could achieve things that I really didn't know what I could achieve. People saw things in me that I didn't know that I had. But as I see you and attending Discovery Days, all I know is that you will have a lot of support behind you. If you're interested in sciences, the choices are endless. There's many, many different fields of science that offer you great promise. And I always say, if the door's open for you, and if you're asked to do something, take it. And the reason is, you can always learn afterwards. It's lifelong learning. I think I'll stop here. Lisa, I think I've done my 2 minutes. And Heather, and I know that Heather and Lisa will have my contact information if being at the University of Manitoba. If anybody has questions or wants to share things with me, please do not hesitate to contact me. Thanks again for the honor, Heather and Lisa, of speaking today.
Thank you, Dr. Cheryl RockmanGreenberg, for that wonderful gift that you shared with us about your story. Dr. Cheryl RockmanGreenberg, I have known since I was a medical student at the University of Manitoba, and of course is an inspiration to all of us in Winnipeg with her work, and is so obviously a deserving of an honor within the Medical Hall of Fame. It's interesting for me to sit here knowing Dr. RockmanGreenberg as a mentor, and then knowing Dr. Nathan Coleman as a student. I met Dr. Coleman, who is our keynote speaker today. I met him as a student in Churchill, Manitoba, and had the chance to work with him as he was training. And to get to know him and his inspiration and his passion for working in the North, and to help to heal and to work on the health and wellness of Indigenous and other peoples who live in rural and northern areas. Even then, when Dr. Coleman was a student, he inspired me to think about my own practice, and he has gone on and studied at the University of Manitoba through our Northern Family Medicine residency program. And then after completing his residency program, has been living and working in Thompson, Manitoba, where I, as a family doctor and a colleague of him now, am so aware of the important work that he's doing in a very extensive and full rounded family practice. So he not only sees patients in clinics, but he works in the emergency room, and he works as a hospitalist, so a doctor who serves patients in the hospital. And he also helps to serve some of the Indigenous communities that are around Thompson. And I know Dr. Coleman also has a priority about training medical students and residents who are coming behind him, and giving them some of the inspiration that he gave to me so many years ago. So I'm very honored for the University of Manitoba to have this partnership with the Medical Hall of Fame. And it's very interesting to sit here with the multiple generations of physicians who work and who have trained at the University of Manitoba. And it makes me just proud to be part of our institution and to have this partnership with the Hall of Fame. So thank you very much. And thank you to Dr. Coleman. And we're all excited to hear your lecture on What Are Your Plans? PLANS.
Excellent, thank you. I'm just going to get my presentation up here. There's sometimes a little bit of a delay, so just give me a second if that's all right. It is a real honor to join everyone today, and for all of our young people joining across Manitoba and possibly even outside, it's great to have you here together. And I'd like to echo what's been said already. Working and training previously with Dr. RockmanGreenberg and Dr. Goulet has been a real treat. And I'm just waiting for my slides to pop up here. But I think it kind of reflects well in that mentorship that exists, regardless of where you end up, is the kinds of things that do go with you for a lifetime. And so I've been asked to kind of share a little bit of my journey with you, and hopefully it's helpful for your journey wherever it takes you. It probably won't be very similar because we all have our own path, and that's the beauty of where we're coming from. And I'm still waiting for a presentation to pop up. I thought I did it right, but I'll try again. All right, well, when it's coming up, last time it took a little bit of time to appear, maybe too many photos. But I think, there we go, it's coming along. I think when we think back, there's always a couple things that come to mind. And when I think of planned, it's always kind of a bit of a bad word in my mind because it has a bit of fear that you have to be ready for everything ahead. And that's not something I've been very good at, actually. So as I think about kind of when I was in high school, I was frequently asked that question, and reflecting back, I think of it quite differently now. So we're going to walk through together, and hopefully what I share with you has some use to you. So when I talk to healthcare providers in different fields, I find that most of them have a story or an event in their life that sparks their interest in healthcare and being a care provider in all the various roles. And for me, as a young person, I lived in quite a different setting. I was in Ethiopia, and there I got insight into what it looks like when you don't have healthcare. That's our front door there, and that mountain that we were living on is about a half day's walk from the nearest health center. Their entire healthcare system consisted of two gentlemen who would jump on a motorcycle and bring vaccinations to the mountain every few months. And besides that, they were quite on their own. We got the benefit of developing relationships with people, and we realized that offering basic services such as oral rehydration for infants with diarrhea or antibiotics or antimalarials had a profound impact. And we had lots of neat relationships that way, recognizing how even small gestures made a big difference when there was a lack of healthcare. I also got the opportunity to spend time with nurses who had spent their lives and daily were able to interact with people and provide care. And it fueled that hunger to be part of something like that, to do something that cared. And so that's kind of where my spark starts as a teenager, but it took a while to get to where I'm going. So what I'd like to ask everyone is just, and you feel free to put in the chat or just think in your head, whatever you prefer, what is it that makes a health care provider what you want them to be? What are those traits that you'd want to see in your healthcare provider, or if you're being a healthcare provider, what you'd like to provide for the people you care for? And I think this is a question that has so many answers. So think of a few of your own, and then we'll take a journey together just to look at what that might look like from my limited perspective. A group of patients was asked this, and these are patients living with chronic disease, asked specifically about their family physician. And what things came out from those that were interviewed, they wanted someone who developed a partnership with them. They want someone who would promote their interests, to know them and start from their personal situation, to legitimize their experience and to acknowledge the strength that patients bring and their own expertise, and to help them maintain hope. I see lots of good things coming out of the side: compassion, dedication, connection. I think you're right on. So for me, what makes a healthcare provider is a journey, and it's never the same, but it's always exciting. I'm joining you today from the traditional territories of the Nisichwayasihk Cree Nation. I live in Thompson, Manitoba, a little bit south of Nisichwayasihk, and 740 kilometers north of Winnipeg. I work in the Northern Health region, and I travel by whatever means we need to get to where we're going. I've circled just in red the places where I've lived and worked across my training and service here, and I get to enjoy a diverse set of settings, really all the way across the north. And each way along the way, I get to learn people's stories, and they teach me, and that's something that's quite exciting for me. As mentioned before, I'm a northern generalist. I do a little bit of everything. I do comprehensive primary care here in Thompson. I work a little bit in the emergency room and do hospital medicine. And then one of my real passions is to work in nursing stations in remote communities where I do fly-in medicine together with just a fantastic team. In my role, I get to wear many hats. And if someone asks, who am I? It's always hard to say, but I think to boil it down, I'm simply a northern doc. And the hats that I wear get to be varied and frequent. I enjoy the work that I do. I've recently had the opportunity to be part of our newest residency program in family medicine based out of Thompson in the Northern Health region. That's been a real treasure, despite starting it in the middle of a pandemic. I've gotten to enjoy working with teams across hospital and outpatient settings, including teams that are across jurisdictions, like the rapid response teams that meet the need for testing when outbreaks occur in remote places. I don't do it alone, which makes it much easier. This is just a little bit of my team up here in Thompson. There's many others and many other teams I'm a part of, including the University of Manitoba. And working together is how things work well. That's the beauty, especially of northern medicine, but really all fields. We're looking at that when you care alone, you're less effective than when you care together. But my journey starts a little ways away. So I'm a bit of an odd duck. My mom was born in the high Arctic, up in what is now Nunavut. My dad was born in East Africa. They're both children of settler Canadians. I was born on the prairies, and I grew up somewhere between Sprague, Manitoba, near the US border, and Ethiopia, a land that I love. Now, growing up overseas made for some interesting choices, and one of them was that the only access to high school I had was to live in boarding school a good many hours away from where my parents were living at the time and working. And there it was a neat opportunity because I had no commute, lots of friends, and all the study time that I could look for, which was somewhat helpful. The downsides included things like the question that seemed to be hard to avoid, particularly when you're living at school, and that seemed to be what adults preferred to ask about most. The question is, what are your plans? The first time I heard it asked, I wasn't too appreciative. I really didn't want to think about it at that time. And I figured that heading into the wilderness and ignoring humanity just wasn't quite acceptable. Now, I was a kid who loved science. I enjoy the sciences and learning and growing. So I gave an answer that I thought would be acceptable. I said, I'll be a doctor. And I realized that I opened a can of worms that would take me down a trail that would last quite a while. I had to find out, how do you actually do that? And our advisor told me that you had to go to medical school. And I found out that in Canada, you can't just simply go to doctor school. You have to jump through a few seemingly arbitrary hoops, including an undergraduate degree and quite a few other things before you can pursue the profession. And so I started to make some plans. Very simply, I knew I had to finish high school, get an undergraduate degree. Science should work. That seemed to make sense. And I'll go to medical school. My plans were done. 7 to 10 years figured out. Well, not quite. As we know, plans quickly change and develop, and often the journey along the way is more important than the plans we started out with. So one of the interesting things about being a foreigner is there's lots of restrictions on what you're allowed to do. One of those for me was the inability to be allowed to work without a work permit. So I had all the volunteer hours I need, but not a lot of work experience and definitely not any savings to be able to pay for school. So as I looked at my return to Canada, I looked across and recognized that Winnipeg was truly a special place. The cost of living was much more favorable than the other places I had looked at. And so in quite a simple fashion, I decided to head there. And it was a really great choice for a lot of reasons I had no clue about. That's where I learned that preparation often takes on a lot of different pieces than you fully expect. I knew the usual. I needed finances. So I did temp work, daycare, and whatnot to make it by. I knew that I'd have to study. I went to the University of Winnipeg and did my sciences there. I studied for exams and got the prerequisites. But the really important things were not the usual, but really the vital. Looking back, the things that I truly needed to develop was the connections, relationships, learning balance in my life, to balance my studies with other interests, whether that's music or the times we spent with others, and to develop perspective, not just my own. My single story wasn't enough. I needed to borrow from others and learn and find the meaning behind a lot of the things that I put my time into. And that's where I recognize that preparation is what really counts. I went and I applied, and they actually let me in, which was nice. And so I got to go to the University of Manitoba Medical School, and finally my step into the healthcare field myself had begun. I had a chance to learn. And quickly I began to learn that learning takes on all kinds of forms. Between Med 1 and Med 2, I had a chance to go to Rankin Inlet, Nunavut. And there I got a beautiful opportunity to learn not just a bit clinical medicine, getting my first steps into the field, but also of a land, a culture, and connection. While I was there, I got to spend time out on the tundra. I reconnected with my mom's family and cousins that I had rarely gotten to see growing up, and fell in love with a beautiful, dynamic place. However, being a new medical student and not a lot of experience in healthcare, I realized that there's much more learning to do. And as usual, the greatest learning often comes out of our failures. I remember one that sticks in my mind. I was working at the health center with one of the advanced practice nurses there, and a young boy had come in, and he was needing some help, and I finally felt confident enough to lead the interview myself, and I was kind of excited, and I wanted to make sure that he felt comfortable. So I was trying to ask my questions really carefully so that he would answer. And I tried, and I tried, and I tried, and I recognized that something was going wrong. All I was met with was complete silence. I asked the questions in several different ways, and then I looked over at the advanced practice nurse next to me, and he was chuckling. And I realized something was going over my head. He tells me, he's already answered all your questions. And for me, I couldn't understand why, because I hadn't heard a thing. And they told me, look at his face. And then I realized that I should have known better. I'd been told this since I was a boy. My mom grew up here. And I was told this earlier, that many people do speak with their face. The raising of the eyebrows for yes, the scrunching of the nose to say no. He had answered all my questions, but I was listening for words, and he had spoken with his face. I had missed the entire thing. Now, fortunately, the nurse next to me had got it all and provided the care that was necessary and was able to meet his needs that day. But for me, I had completely and utterly failed. But it also showed me that failure is how we learn best. And it told me to listen a little bit harder, to be careful to assume everyone's going to speak the way that I do, and therefore grow. So learning often comes best out of failure. The other thing that often happens with plans is they change. I think 2020 has made that clear for everyone. And I know that probably many around this virtual room that we're on together have had to adapt in new ways. And I think that's no different for myself. The art of life lies in constant readjustment to our surroundings. It is very true. For me, there was a couple things that really exemplify that. But for me, one of the key ones is I'm a father of 4 children, and I had kids going into medical school, and it was a real treat. But when you fall in love with northern medicine, you realize that miles are going to be put on, and many miles of separation can have their side effects. I wasn't wanting to be away as frequently as my calling led me to want to be. We had to figure things out. And so what we decided together is to travel together as often as possible. Instead of investing in a house or a vehicle, we decided to put that money into bringing them with me together. So my kids came and joined me up in Rankin Inlet, Churchill, Thompson, and as many places as possible. They got the opportunities to get out on the land. They know where meat comes from. They also know that the best berries in Manitoba are picked outside of Shamattawa. And this was a real opportunity, and it really changed something for me too, because no longer was I just leaving them for the dream that I had, but rather that we were journeying together, and their journey was as much as theirs as mine. And that's what it's often like when we're finding that need, that we need to be needed. The best way to find yourself is to lose yourself in the service of others. So what I'm going to do here for a second is just change gears, and I'm going to put you into my shoes for a brief moment. We're going to walk through a case together and just kind of imagine what we need to do and how that looks different depending on where you are. So you're going to join me in the emergency room today. A 62-year-old woman comes in. She's in respiratory distress. She's hungry for air. She needs your help. She has a past history of asthma, high blood pressure, and possibly heart failure, but you don't have her chart right now, so you're not quite sure. You know that she's on blood pressure pills and puffers, and when you check her oxygen levels, they're low. She's breathing very fast. Blood pressure is okay, and her heart rate's a little bit quick, but she looks sick. She can't lie down, and she's using all of her muscles to breathe. When you place your stethoscope on her chest, you hear reduced breath sounds and just a little bit of wheeze. You know it's an ominous sign, and when you look at her airway, you realize it's short and thick. It's going to be difficult if you need to put a breathing tube in. You know that she's the sickest person in the room, so everyone else has to wait. Now, fortunately, we're in Thompson with a busy emergency room and a big team. The nurse has already started high flow oxygen, and you've ordered continuous bronchodilators to get her airways open, to get the air out so new can come in. You give her IV steroids to treat the asthma exacerbation, cover her for a pneumonia, and if she's not responding to that, you can add magnesium sulfate. You get a list of investigations to help guide your management, a stat blood gas, labs, and a portable chest x-ray. You consider putting her on non-invasive positive pressure ventilation, like in the picture there. And you call the anesthetist because you know that if you need to put a breathing tube in, it's going to be difficult. As you continue to manage her, her chest x-ray comes back showing pulmonary edema. There's fluid on the lungs. You give her IV diuretics or water pills to pull some of that out. Unfortunately, she still requires more and more air. And despite therapy and adding the positive pressure ventilation, you realize that she needs help with her breathing. Anesthesia helps place a breathing tube using a fiber optic assisted intubation, and she's able to be safely transferred by the flight team to the ICU. Working as a team has its advantages, but not all teams look the same. So what if we're in the nursing station? My team's a little smaller. We still have many tools. We still work closely together, but it changes things a little bit. High flow oxygen, absolutely. The nurses got that running right away. We're giving continuous bronchodilators just like we would in Thompson. IV steroids, antibiotics, and magnesium sulfate, all we have on hand. And then things change a little bit. We have a nice x-ray machine, but it's in the other room and she's too sick to move. Our non-invasive positive pressure ventilation isn't an option right now, and the nearest anesthetist is 2 hours flight away at the very least. So we have to adapt and make the best care we can. Fortunately, we have a few other tools at our disposal. I carry around an ultrasound machine, so I place it on her chest. The chest x-ray is in the next room, and I see what looks like a bunch of foggy lines and maybe a few spotlights shining through a snowstorm. Now I know that this is a sign that her lungs are wet. So even though we don't have a chest x-ray, we can recognize that she does need the Lasix, and we can add that to her therapy, which we might not have otherwise. We call for transport early, as soon as possible, because we know that it's a long flight from Winnipeg to get the help that she needs. We also know that maintaining her airway as long as possible is the goal. If she can keep it open and keep breathing, she'll do the best, because if we have to intubate, it's going to be difficult. She does require breathing assistance. And so we place a supraglottic airway, an airway that sits above the larynx to provide the ability to ventilate her and assist her breathing. And me and the nurses take turns to bag her until the transport team arrives and drives her to the ICU. The need looks different depending on where you are and what your team is. But I think that's the beauty of Northern medicine, is that you adapt to what you have. We adapt to times. Certainly this year's been no different. And I know many people across our healthcare systems in all kinds of ways have made new ways. We're all learning that it turns out we can phone people and do medicine that way. We can do things differently. In Northern medicine, we get to practice cradle to grave medicine. We adapt to those resources at hand. We call confidently for help because we know that our patients need it. Whether someone's acutely ill or chronic and has many different complex needs, we get to experience generalism at its best. We're always doing it with a team. Working alone just doesn't seem to be something that works up here. And you are guaranteed to have lifelong learning. Our first success seldom stays for long if we won't work hard to sustain the momentum. I think that's often true. Getting somewhere, our plans and where we're going don't tend to cease once we get there. In fact, often that's where they feel that they start to reinvent themselves all over again. I've had a number of knowledge keepers give me some very useful advice, and this one came from two sources. When you have two strong coaches telling you the same thing, you know it's important to learn it. And the question that was asked of me was, how can you care for me if you can't care for yourself? And I recognized that that's something that I hadn't worked enough on until recently, that the kind of care provider that we are includes the way that we care for ourselves. And for me, I realized I need healing, and there's a number of places where it comes from. Being up in the north, we get the opportunity to experience the beauty of the land, and the land is therapy. So this is me and my kids out on the Burntwood River behind our place, just enjoying the winter last year. So we're excited for the snow to be falling. But I think the ability to connect with the natural world and see how it refreshes us is a real treat. And being a northern doc, it's not far away, although I don't think it's inaccessible to any of us if we want to try hard enough. The land is beautiful, and it's beautiful year-round. The other connections that come and sustain us are often people, whether it's family, mentors, learners, my patients, who are my best teachers. They're the ones who keep us going. So as much as I provide care for people, I'm learning more and more that they're providing care for me. And the fact that it goes both ways is something very beautiful. So I'm no longer so afraid when someone asks, what are your plans? Even though I might have less of them now than I did before. I'm still ready to prepare. And I know that the preparation I do might not be used the way that I think it will. I know that learning continues lifelong and most often result from failures. A better chance to do it next time. I'll adjust my plans, as 2020 has taught us all. It's a constant reminder of what we need to do. And there's a need that I have to serve, but a need that also that I am uniquely made to meet. And when you find that, if you can sustain in it and continue, you know that plans are going to work out just fine, even if they're quite different than you might have envisioned previously. So how about you? You've got all the potential. I know that if we looked 10 years down the road, we would be shocked at the things that are going to be achieved by this group here. And I would encourage you to be looking to prepare in a way that's going to take you wherever it turns, to learn from failure, to adjust your plans often, to find the need that you're suited for, and to sustain in it because people need you there. So wherever your journey takes you, have plans to care, because true care is helpful almost anywhere that you go. Well, that's a little bit of a glimpse into my journey. I hope that it's helpful for all of you. I think we might have some time for some questions and answers if I'm not incorrect.
Yes, Dr. Coleman, there's a couple questions in our Q&A, and let's take a couple minutes to review those. One of the ones, why don't cities like Thompson have medical equipment like Winnipeg so that they won't have to travel the long distances?
I think that's a great question, and it's a question that we ask frequently. The challenge of being on Earth, now I will say in Thompson we're a little spoiled. We do have a lot of things that are typically limited to tertiary care centers because we have the distance. The challenge is that investing in its equipment or other measures, it takes good, careful planning. And I think for all of you here, it's great to be a part of that. I know there's a lot of work that goes into it, and finding out how do we bring care to the right places is a question that's being asked frequently. But it's a journey, and it really boils down to having someone do it. And so I really look back at a lot of the things that I have access to now here, which I felt more spoiled than I ever realized I would. And it's usually there's a person's name attached to it of who did the work to make that happen. So in the long and short is there's always going to be limitations, but the answer to those is a person's name most often. And so perhaps you're the answer to the question.
We'll do one more quick question, and I do apologize to the others. We're not getting to the rest. Do you find your job stressful?
Absolutely. But there's different kinds of stress. The trying to fit the amount of work that I'd like to do into the time I actually have rarely pans out well. But the beauty of it is it's work that I genuinely love to do. So in some ways, yes, it's stressful. When people are unwell, you feel a need, and sometimes you don't feel like you're able to quite meet that need the way that you like. So that creates that conflict. But the other side is that there's also stories of really strong people that they share with you on a consistent basis. And that's a constant reminder of why I actually came here to do this in the first place. And in that way, it recharges you. So yes, it drains me, but fortunately, it also, for me, recharges me at the same time. So the stress is well worth it.
Well, I think that's a good note to end on. Thank you so much for joining us today, Dr. Coleman. And one of the first, actually, it was early on in your presentation that resonated with me is when you care alone, you are less effective than when you care together. And I think that's, that's what today is all about. It's working as a team, and we achieve much greater things when we work with our colleagues and when we care together.